Hello, my name is Gal Andres. I live in Claremont, California, small city outside of Los Angeles. And my question is about Judaism and psychiatry. I'm currently a psychiatry resident, and I'm curious what wisdom the Torah has to provide on mental illness. Are there any stories that talk about it? Any ancestors who suffered from it? And then what insights do we have that maybe help us understand the etiology or how to treat it, or any wisdom available?
Okay, Torah has wisdom and insight on everything. Much of it is revealed to us. Much of it is sometimes in the mystical realm and maybe beyond our ability to access fully. When it comes to basic Torah living, we're talking about normal, the range of normal mental health. When we talk about mental health issues that are beyond the normal range, then we need some specialized, just as we need specialized treatment and specialized providers, we need specialized information from the Torah as well. But there are some very universal principles that we find in the Torah. To share with you a little footnote of history. There was in Jerusalem, maybe about 50, 60 years ago, a professor, a psychiatrist. He was the number one psychiatric provider. His name was Dr. Halperin. And they used to take the most serious cases to him. And they once interviewed Dr. Halperin, and they asked him, what do you do when you can't help this patient? He says, I send them to this great rabbi, Rabbi Aryeh Levine. He was known to be the prisoner's rabbi. He was a very pious man who spent his whole life just doing acts of kindness and helping everybody. And they went and interviewed Rabbi Aryeh Levine. They asked him, what do you do when Professor Halperin can't help them? And he says, all I do is listen with a little bit of empathy. He says, empathetic listening can go so far to help someone. Now, on the extremes of psychiatric issues, that's much less. But it helps everybody somewhat. And sometimes on the borderline issues, I don't mean borderline personality, I mean borderline issues on the normal versus almost a little bit beyond. Just that somebody cares, that somebody feels my problem, that somebody validates my problem. See, one of the problems that we have when somebody says something that's off, what we try to do is to try to show him why he's wrong. The first thing you have to do is show him why he's right. Make him find what's good. Make him feel good about himself. The core of the human mental health is feeling good about myself. Some people get to the extreme where they can't possibly feel that. That's where medication comes in. That's where therapy comes in. But that's really, and the Torah teaches us that. When a person feels good about him or herself, that is the beginning of mental health. That is the foundation of mental health. So that certainly is something that Torah teaches us. Torah also teaches us that when we go beyond the norm, that doctors are given divine permission to heal patients. The Torah tells us that a doctor has because you could ask the question, and some religions do, if God made him sick, what right do we have to heal him? The Torah says no. The doctor has that responsibility, has God's permission to help him, and that's why doctors help. We do believe in Judaism also that when we're dealing with health issues, and mental health issues are no exception, we go for the best. We try to get the most competent, professional help that we can, because then we have done ours to try to help the situation, and then, after everything is said and done, we rely on God to do the ultimate healing.